Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Good evening, listeners. Thank you so much for tuning in. You're listening to the Balancing Life and Business Show with Norma G, and we are here with Dr. Luis Escobar with Got Pain, Avoid Surgery with PRP and Stem Cell Regeneration. Again, that's with Dr. Luis Escobar. Welcome, Dr. Escobar. So good to see you again.
Good to see you, Norma. Thank you for having me again.
That's great, great. Well, we were here together last week, and since we saw each other, you know, South Florida has been kind of experienced a little bit of a fire drill. And everything okay with you and your family and your offices and everything?
Everybody is fine. Thank you very much. Funny you said that because we've been talking about the weekend warriors. And now this week, starting today, we started seeing the hurricane warriors.
Oh, the hurricane warriors.
Yes, we have several patients that were setting up for the hurricanes, bringing things from the outside to the inside, putting up shutters, and there's quite a lot of injuries.
Oh, well, that's interesting.
We end up having more patients with back pain, shoulder pain, knee pain. Seems that every time we do activities that we're not used to do on a daily basis, then we end up hurting ourselves a lot easier.
And so you saw that just today alone, kind of everybody getting back to everything today alone in your practice?
It seems like today we saw everybody in town because last week it was a very short week. First part of the week, we had a lot of cancellations because people were getting ready for the hurricane.
Yes, that's right.
And the second part of the week, we were closed because we were told that we should close. And so we did. So today, everybody came to the office. So we had a very long
I imagine it'll
day.
probably stay that way as the whole week goes because sometimes people don't feel their aches and pains until a few days later.
That's correct. And we have to catch up. So we have to see our regular patients, and then we have to see the newly
well, then
injured
I double
patients.
thank you for still making the time to come in and be with us here today. And as I mentioned, that today we're going to be talking about Got Pain, Avoid Surgery with PRP and Stem Cell Therapy with Dr. Luis Escobar. You can listen to today's show in your car on your AM radio 1470, on your computer at www.nnradio.com and at AMP2 TV Productions on Facebook. You can also listen on your iHeartRadio app at AM 1470. If you'd like to call in today for any questions for Dr. Escobar, you can reach us at 1-888-565-1470. I'm your host today, Norma Guerrero, and Dr. Escobar will be talking about solutions to your acute and chronic pain conditions using the latest medical advancement technique called platelet-rich plasma and stem cell therapy. Dr. Luis Escobar has a background in anesthesiology and is a pain management doctor. He has 3 offices located here in South Florida, in Aventura, Pembroke Pines, and in Hollywood. You can contact his office at 954-322-8586. Again, his office number is 954-322-8586, and his office is bilingual. So if you're Spanish speaking, he can help you. Him and his staff can help you. So, Dr. Escobar, tell us once again, our listeners, what is PRP and what is stem cell therapy in relationship to people suffering with pain?
Well, these two treatments, starting with the platelet-rich plasma, the PRP.
That's platelet-rich plasma.
That's what the PRP stands for. Platelets are cells that are circulating in our bodies, and they are the first line of response when there's injury that occurs in the body. platelets are known for their characteristics of clotting mechanisms. The first, when you cut yourself,
You say
platelets
clotting?
clotting.
Clotting
Yeah.
mechanism. So
When
then when
you-
we have an injury, you want the blood to
Correct.
clot.
If you have a cut in the skin, for instance, the first thing happens, you have some pain, that starts some signaling, and that attracts some platelets who are already circulating in the bloodstream, and they go to the wound and try to stop the bleeding. At the same time, these platelets release a lot of chemicals that produce what we call signaling, and this starts all the healing process. When it's a small injury, such as a paper cut, for instance, then the platelets will stop the bleeding. There will be a minimal inflammation, and the case is closed. If the injury is a little more severe, the platelets alone are not enough to heal this injury. They will help with the clotting process, and they will call other cells into action via chemicals again, chemical signaling with cytokines and growth factors and a bunch of different factors, and attract more sophisticated cells into action.
So when you have a minor injury or like a paper cut, the platelets go and they they heal the area. But when you have a little bit more of a significant injury, the platelets will recruit some more sophisticated type of cells to come heal that area.
That's correct.
And that's what happens in a normal
And that
injury
would be,
process.
That would be the normal healing process
Okay.
that we all have. These more sophisticated cells would be the stem cells.
Okay.
Stem cells are circulating in a small number in the bloodstream.
Okay.
They are pretty much in every tissue in the body. Teeth, the synovium, the bone, they all have stem cells which are ready there to heal injuries
Okay.
when they happen, and to continue the process of regeneration of our
Yes.
normal tissues. Now, when there's an injury, these stem cells are recruited from other areas to try to improve the healing process. There's a process of clotting, there's a process of inflammation. Sometimes this inflammation process is over-exaggerated in our bodies, and that can be counterproductive. Now, and then we have the stem cells. The stem cells are cells that are known for their ability to replicate. And they can replicate to a different type of cells within the body, depending on where the injury happens. So a stem cell, what's called a mesenchymal stem cell, can convert into
What kind of stem cell?
mesenchymal
Mesenchymal.
stem cell.
So they can kind of disguise themselves as a different type, not disguise, but assimilate.
They will
assimilate-
modify themselves
Modify.
into a different type of cell. A mesenchymal stem cell can become a skin cell, may become a muscle cell, may become a tendon cell, or a chondrocyte for the cartilage in the bones, or a bone cell per se. So depending on what the injury is, these cells have the capability of becoming one of those cells to produce the regeneration that is needed.
So what you're describing is the normal healing process. So why would somebody want to go and receive a treatment of an injection of a platelet-rich plasma or a stem cell? What would be the criteria? Who would be a candidate for that?
Excellent question. If the patient is not healing properly, or if the patient is not doesn't perceive that he's healing properly or fast enough, that would be a good candidate to have this mode of treatment. What we are achieving or trying to achieve with this treatment is to bring all those stem cells and the platelets via platelet-rich plasma to the site of the injury to multiply the response, what will be the normal response of the body to make that regeneration faster. When you have an injury that becomes chronic, and what we mentioned before, that the inflammation may be exaggerated, that can be suppressed by stem cell and PRP treatment, suppress the inflammatory process, and proceed to the regenerative part of the healing process.
So basically, to our listeners out there, if you are experiencing back pain, shoulder pain, ankle, hip, wrist pain, and you have been, it's not healing properly. This stem cell PRP therapy is a injection that gets harvested from your body and then helps deliver a larger dose of your own plasma and of your own stem cells to help regenerate the healing process.
Correct.
And so, what I want, we're going to go to commercial break now, and when we come back, what I'd like to talk a little bit more about is how does this get harvested? Because many people might be thinking about, well, how do I obtain the PRP out of my own body, and how do I obtain the stem cells? Again, you're listening to Dr. Luis Escobar on how to avoid pain and avoid surgery using PRP and stem cell therapy, and we'll be right back.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialists of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairmen of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
Welcome back, listeners. You are listening to the Got Pain Avoid Surgery show with Dr. Luis Escobar, and we're talking about PRP and stem cell regeneration. Dr. Escobar has 3 offices located in Aventura, Pembroke Pines, and Hollywood. The name of his office is Pain Care Specialist of Florida, and his contact number is 954-322-8586. And again, their office is bilingual. Dr. Escobar, tell us again, who is a good candidate to receive PRP stem cell therapy?
Norma, any patient that wishes to promote faster healing will be a good patient for this mode of treatment. Whether the injury is acute and wants that injury to be healed faster, or whether the problem is chronic and has not been able to heal without any intervention, that would be a great patient for this mode of treatment, because we can enhance the normal ability of the body to heal by, as you mentioned before, to bring a large number of stem cells and platelet-rich plasma to the site of the injury, which we precisely apply directly under fluoroscopy or ultrasonography to the site of the injury.
So you said two key words that I think the listener may be listening is, number one, heal faster. Everybody wants to heal faster because who wants to have persistent pain? And also people who are suffering with chronic pain, because those things ultimately may lead to perhaps a doctor may be telling you you need surgery to correct this problem. So you're trying to say that this type of procedure may actually keep somebody away from needing surgery, depending on if they are a candidate for this, or if their condition is a candidate for it.
Absolutely, yes. You put it correctly. There's a third subset of patients that have degenerative disease. Most common degenerative disease that pretty much all of us have or
degenerative
will have.
Diseases?
Yes, such as osteoarthritis.
Osteoarthritis?
Which is, in essence, loss of cartilage in our joints from overuse. And these patients are subset of patients are very good responders to the treatment with the stem cells and platelet-rich plasma.
So patients with osteoarthritis have a very good response?
Yes.
with the PRP and stem cell
Yes.
therapy, and that's you said osteoarthritis is when there's a loss of cartilage.
Loss of cartilage.
And cartilage is, what is cartilage exactly?
Cartilage is the soft cover of the bone in a joint, and that's what allows the bone to be smooth. And so the bone, I don't know if you heard the term bone on bone. Bone on bone refers to the loss of the cartilage on severe arthritis, and it hurts. It hurts because when you're rubbing bone on bone, it's almost like having a fracture. So fractures, as you know, are extremely painful.
So it can help regenerate some of the cartilage?
It may regenerate the cartilage, correct. The earlier in the process that we treat this, the better the response. But it's amenable at any time on the disease process. There's several factors that come into play. One is the pain factor. Stem cells and platelet-rich plasma decrease the inflammatory process and produce pain relief. And then the stem cells help to regenerate the cartilage to a certain degree. And then by doing so, in the long term, will be decrease of the symptoms as well. When we are doing treatment with stem cells for osteoarthritis, let's say moderate to severe, we want to wait at least 6 months to actually say that, yes, they did help or it didn't help.
Sure.
So it is a process. But early on in the process, there is decrease of pain. Even if there's not regeneration of the cartilage, there's improvement of the symptoms before the cartilage regenerates, and you can actually see changes in the X-rays and the MRI.
So I think for many of our listeners out there, they're familiar with pain, familiar with going to visit their doctor, and they may receive a steroid injection. So how does this differentiate from a steroid injection? And also, how do you retrieve and harvest the PRP?
Okay, two different questions.
Sure.
The difference with the steroids, corticosteroids are pretty much naturally occurring substances. We produce corticosteroids in the body, and they're anti-inflammatory for the most part. Among most other functions, but the one that we function that we want when we're using for any knee pain or osteoarthritis is the anti-inflammatory process. Does it cure anything? It does not, but it does give you some relief because it decreases the inflammation and has some pain relief properties by doing so. The difference is that between steroid injection and a platelet-rich plasma or stem cell treatment is the one is regenerative, whereas the other one is only anti-inflammatory and could be counterproductive.
So that's the key word, is that one is regenerative.
Correct.
And that's what we want, is something that's regenerative in our bodies to speed up the healing process and to heal the injured area.
To return to your natural stage.
Not just stick, inject an anti-inflammatory to help reduce the pain, but actually help heal the area.
Correct.
Okay, and so how does that work? How do you obtain the plasma, and how do you obtain the stem cell in the body?
Well, it's two parts to the treatment. The simplest one is the platelet-rich plasma. Platelets are circulating in our own bodies through the circulatory system. And all we have to do is draw some of the patient's blood, process it via special centrifuge, separate the different cells, and we discard the red cells and the leukocytes, and we just keep what is called the platelets with some of a small amount of the plasma.
So you basically draw blood from somebody's body, and then you place the blood into a centrifuge?
It's a special
and the centrifuge spins it around?
Spins around.
And isolates
and
out.
And by gravity, that separates the different cells in different layers, because these different cells have different densities. So by centrifugation, that's a very common process. Whenever you're going to your doctor, they say, we've got to have a CBC, a complete blood count. You have to spin that. The first number that you get is what is called the hematocrit. And that refers just to how much the red cells compress within the sample of blood, and the percentage it is, that's why your hematocrit is.
So you kind of pull out the red blood cells and just keep the platelets.
We don't want the red cells.
We don't want the red cells.
They don't have any effect on the process. And we don't want the white cells either, because the white cells may be involved in other inflammatory type of reactions. So, and the cells that we really want is the platelets,
The
which have
platelets.
all the chemicals, the cytokines, and the growth factors,
The good stuff.
anti-inflammatory, all the components that are going to help with the
With the regeneration.
regeneration and in the symptomatology as well.
Okay. And then how do you harvest the stem cell?
The stem cells, as we mentioned before, pretty much they are every organ in your body, every skin has stem cells, your bones have stem cells, your teeth have stem cells. But the most abundant areas are the bone marrow on the large bones, like the pelvic bone, the femur, and the adipose tissue, all the fat cells in the body.
Okay. So if the bone marrow and the adipose tissue has the highest concentration?
Has the highest concentration, being the adipose tissue by far higher, highest than the bone marrow.
So you just pull it out like probably around your stomach area where it has a little bit of adipose. You just pull it out.
We can use the abdomen. You can use the pistols. Your hip. You can do the back. It pretty much anywhere in the body where there's some extra adipose tissue, and it's extracted via what we call a mini liposuction. We call it mini because the amount of fat that we take out is pretty much about a large syringe, like 60 cc's to 120 cc's of fat. So it's not a when you have going for a cosmetic liposuction, we're talking about liters of fat that is removed. So this is a small amount.
It's a small amount.
And it's done through via a very tiny incision, so less than maybe 2 centimeter. It doesn't even need any stitching afterwards. You just put a little butterfly Band-Aid, and so there's no scar that comes from the minimal liposuction. This is all done under local anesthesia on an outpatient basis. It's always,
it's an outpatient treatment.
It's an outpatient treatment, correct.
Okay.
And it's always the patient's own cells that are harvested, treated, separated, and injected into the same patient.
So you can do it in your office.
We do it in the office.
Okay.
That's correct.
Okay.
There is zero risk of rejection because it's your own tissue. Rate of complications extremely low, if unheard of.
So you basically draw the blood to obtain the plasma, and then you I guess I don't know what's the word you want to use.
Harvest.
You harvest the stem cell.
Correct.
And then you mix them together.
We, after their process, yes, we mix them together.
And then you inject them back into wherever the person's pain site may be.
Correct, the pain site or the area that we want to regenerate.
The area that you want to regenerate. And so now, is this procedure, is it covered by insurances?
Unfortunately, it's not.
It's not?
It's not.
Okay. And so if people want to find out if they're a candidate or how many treatments they may need, you find that it's kind of very difficult to say how much this would cost. They have to contact you, and you need to assess them to determine.
Correct. I mean, a first good step would be to determine whether the patient is a good candidate for the procedure. And there are very few exceptions, such as infection or malignant disease, patients who do have cancer. You don't want to be taking cells from one area of the body and
So someone with like an autoimmune condition?
No, autoimmune condition would be a good candidate for treatment.
Okay.
But infectious disease would not.
So someone who has an infectious disease or a diagnosis of cancer?
Active cancer.
Active cancer. Okay.
Correct.
So if they're in remission or if it was
patients who
taken
have,
care of years ago?
It would be a good candidate,
It would be a good candidate.
Patients who have bleeding disorders or are anticoagulated and cannot stop the anticoagulation for the procedure, that would be a disqualifier. But if the patient can stop the anticoagulation for a few days, that would make it a good candidate.
Wow. Well, that's really a fascinating treatment. So I know that there's a lot of people out there that have pain and they want to get back to their athletics. They want to get back to their personal life. Like you said, a lot of people got injured this week, and so who knows how they're going to recover. And so this procedure helps regenerate, not just kind of cover it up, not just kind of just cover it up with some pain type of medication, but actually helps take the good cells in your body and give them a boost. Would you say?
Absolutely.
Give the platelets and give them a boost, and the stem cells and give them a boost, so you can speed up the recovery of healing?
Speed up and create the type of scenario where can be regeneration. A patient who has not been able to bring enough of these good cells into the site of injury, we can actually take him and bring him to this area and help him continue their healing and regeneration if it's a degenerative disease.
Well, Dr. Escobar, I know that many people out there will want to contact your office and find out if they're a candidate for this so they can live healthier, stronger, and lives with less pain in their body. Again, he has 3 offices located in Aventura, Pembroke Pines, and Hollywood. He can be reached at 954-322-8586. His website is www.painconsults.com, and he can be found on Facebook at Pain Care Specialists of Florida. Thank you so much, Dr. Escobar. We appreciate you coming in, and we hope that this week you'll be able to help many people with those injuries they had. And thankfully, we're all safe down here in South Florida after this.
Definitely will. Thank you very much, Norma,
have a good
for
week.
having me.
See you next week. Bye-bye,
Yes,
Dr. Escobar. Have a good weekend, listeners. We'll see you next week.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.